The advancements in the fields of medical telepresence and robotic surgery will yield a huge shift in surgical operations. We argue that by 2099, medical surgery procedures will no longer be performed by human surgeons. Instead, surgical operations will be performed by robotic machines that will be completely independent of human assistance.
Up until the late 20th century, traditional forms of surgery had problems such as retained surgical equipment, human error in sanitation, longer hospital stays, and even the need for reconstructive plastic surgery.
I probably don't do a single operation today the way I was trained to do it as a surgeon. There's that much change.
The introduction of minimally invasive laparoscopic surgery using smaller incisions improved on the complications of traditional open surgery, resulting in shorter hospital stays and reduced pain and blood loss. However, laparoscopic surgery is limited in the range of motion and depth perception of the rod lens. The most popular artificial intelligence in the field of robotic surgery is the Da Vinci system. FDA approved in 1997, the Da Vinci system was invented by Intuitive Surgical. In 2000, lawsuits were filed against Intuitive Surgical by Computer Motion, another company which had robotic-assisted surgery copyrights. In 2003, the two companies merged and the Da Vinci system still stands. Today, the Da Vinci system is used mainly in the field of urology on the prostate, kidney, and bladder. Over the course of 3 years between 2007 through 2009, the number of surgeries assisted by the Da Vinci system increased from 80,000 to 205,000. The Da Vinci system is comprised of 4 parts: a console for the surgeon that displays a high-definition view with controls, a patient-side cart with 4 mechanical arms, an instrument set, and an additional display for the rest of the operation.
One type of technology that will assist in the future of robotic surgery is radio frequency identification, also known as RFID. Many industries use RFID because they are small chips inside tags that can transfer data without having a line of sight. At the present time, RFID tags are used in the medical industry to improve efficiency by tracking instruments and equipment. In the robotic surgery field, small RFID tags can be implanted within the hand or arm of a human. Information such as medical history, genetic makeup, blood type, and date of birth can be stored in an RFID tag and could help surgical robots conduct diagnostic tests. We believe RFID will make a substantial impact on the progress of independent surgical robots.
The main obstacle facing our thesis is the independence of the surgical robots. Currently, they are only able to perform operations under the control of a surgeon. However, we still believe by the year 2099 that surgical robots will in fact become autonomous. One way this can be achieved is through cloud computing. For example, a project known as RoboEarth is a cloud-based platform that the artificial intelligence within a robot could theoretically access using the internet and random access memory. The RoboEarth platform would act as a massive data warehouse containing high-definition images. These images can be interpreted and used by surgical robots to make decisions when performing an operation. Let's go over an example of how this might work. Thousands of images are placed within the RoboEarth repository. These images contain vital data about the operation it is depicting, information such as point of entry, tools used, and the execution of the operation. So, a patient is placed onto an operation apparatus. This may be a bed or a tube of some sort. The surgical robot diagnoses the patient and determines what surgical operation is necessary. Then, the robot accesses the cloud-based RoboEarth via the internet and retrieves a series of pictures that can be used as a guideline to perform the surgery. In summary, with the combination of the different technologies mentioned, the field of robotic surgery will continue to advance and eventually reach our thesis.